Hi, my name is Naida. I'm a student at Nightingale College. I'm in my attire. I got my badge with my name on it. Hair is up, no jewelry, nothing on my neck. Hands are nothing on my hands, nothing on my wrists, elbows completely clean. I'm going to be doing hand hygiene. Give my patient privacy. I'm going to introduce myself. My name is Naida. I'll be taking care of you. I'll be a nurse. I did my patient identification. She gave me her name, date of birth, MRN, and then my patient's in a comfortable position right now. She's doing great. I'm going to be explaining the patient what I'm going to be doing today for my deep tender reflex video. So deep tender reflex is a test that is quickly and painlessly checked. I'll be tapping certain tendons with a small hammer to see how her nerves and muscles respond. It helps assess your nerve systems and muscle functions. The reflex involves a sensory nerve, a spinal cord synapse, and a motor nerve, allowing for a quick response to stimulus. Assessing deep tender reflexes helps clinicians evaluate the integrity of the nervous system, specifically spinal cord and peripheral nerves, and can help differentiate between upper and lower motor neuron lesions. This can be done on any patients, but it is important to do it for a patient that is pregnant because it can show complications such as preeclampsia, meaning if I tap on the patella of the pregnant patient, it will go into a hyperreflexia, and other signs and symptoms that the patients have can lead to preeclampsia. Hyperreflexion is an increased or exaggerated reflex, which can indicate an upper motor neuron damage. Hyporeflexia, which is diminished or absent reflexes, which can indicate lower motor neuron damage or peripheral nerve issues. And deep tender reflexes can provide valuable information about patients' nervous system functions and can help diagnose conditions like spinal cord injuries, multiple sclerosis, and peripheral neuropathy. There are different kinds of stages. 0 is absent reflex. 1 is a trace response or maybe a diminished reflex part of it. 2 is a normal response. 3 is a brisk response, which is slightly hyperactive. 4 is a hyperactive response with clonus, which we'll talk about at the end of the video. This is a rapid repetitive contractions of the muscle. And then we're going to be checking for tendons on my patient right now. We're going to check the bicep tendon, which is right here, the tricep tendon, the patella, the Achilles, and at the end we'll do the clonus one. We'll explain a little bit more about that. So this is where the bicep tendon is. So we're going to use the more of the Sharpie point of the hammer. We're going to go ahead and tap there, and her arm should be going up. So I'm going to find her tendon. Okay, relax the shoulder. There, thank you. And then, thank you. So that's the bicep tendon right there. And then we're going to do the tricep tendon. So keep your really, really, really relaxed. We're going to do the exact same thing. It's going to be the pig point of the hammer. We're going to find her tendon somewhere over here. Okay, and here we go. 1, 2, 3. Thank you. 1, 2, 3. Perfect. Thank you. Next is going to be the third tendon. It's going to be the patella tendon. Her leg's going to be very, very relaxed. I'm going to find the indentation between the patella and her tip fib part right over here, the upper part of her tip fib. We're going to use more of the flat, rigid part of the hammer, and we're going to hit right in between that, and her leg should be going up. Thank you. One more for good luck. Thank you. At the bottom, we're going to do the Achilles. So we're going to dorsiflex her foot up, and we're going to use the same motion, which is the flat raised part of the hammer. And we're going to hit where the back of the Achilles is. We're going to find the Achilles, and then her foot should be moving up. Thank you. Okay. And then those are the 4 tendons we're going to look, and now we're going to be checking the clonus, which is a really important part of the assessment of deep tendon reflexes. A clonus is a rhythmic, oscillating stretch reflex, which is also characterized by involuntary and rapid contractions and relaxations of the muscle. This is often seen in the ankle, which is we're going to be focusing on that. And clonus is often associated with the upper motor neural lesions, which are the damage to the nerve pathways, which connects into the brain, the brainstem, and the spinal cord. So we're gonna go ahead and have the leg be completely relaxed. Relax, relax, relax. So we're gonna go dorsiflex. Here you go, and I'm gonna let go, and her foot should be falling straight, relaxed, and dangling, just like that. One more time, just like that. If by any chance we did a clonus and we're dorsiflexing and I let go, her foot will be moving this way a couple of times, rigging for a few seconds. That means that there's something going on with her possible spinal cord. So her dorsiflexing up and then dropping the foot is a normal response. Dorsiflexing up and I drop and she shakes is an abnormal response. My patient is in comfortable position. Are you doing okay?
Yes.
Thank you. And that is the whole explanation. Pete, do you have any questions?
No.
No. Okay, thank you. And that is my demonstration video. I'm going to go do hand hygiene again. Hand hygiene, hand hygiene.